The first step towards a cosmetic closure involves crafting an incision well. Let us see the correct way to handle a scalpel. You do not operate while holding the scalpel like this or like this because you don't want to stab anyone. At this point, I'm holding a BP handle number 3 with a number 15 blade loaded upon it. This is meant for creating small incisions of a fine dissection. As such, hold the scalpel like a pen. You can use it to gently create an incision with your left hand applying traction at right angles to the incision, like so. Never cut towards your own fingers, lest you wish to injure yourself. Once again, make the incision at a right angle to the direction of your traction. When holding a BP handle number 4 with a 22 blade loaded upon it, my aim would be to create long sweeping incisions for laparotomies or thoracotomies. So hold the scalpel like you see here with your index finger steadying the blade while applying pressure upon its belly. With adequate perpendicular traction on the skin, you will be able to make the incision on the skin at one go, avoiding multiple passes that would otherwise create an irregular or jagged skin incision.